please provide some background about this collaborative study and how it differs from other studies you've done.
Sure. So using the telemonitoring program was something that was started from the Geisinger Health Plan. They worked with the company that makes the software and the telemonitoring equipment, and were trying to extend their reach to find the patients, to be able to stay in touch with the patients that were discharged from the hospital. And the goal was to try and prevent them from ending up right back in the hospital less than 30 days later, or keep them out of the emergency department as well. And ever since Geisinger started using case managers and a more patient-centered medical home approach to primary care, they've been trying to do that. And in the beginning it was a much more manual process, where when they found out that a patient was sent home from the hospital, clerical staff in the office would be calling them and trying to ask some questions, and then if they found out that the patient needed additional attention, they would go back to the case manager with that information. But as you can imagine, that is incredibly time-consuming, and limits the number of patients that you can reach in a given day. So in 2009 was when Geisinger Health Plan decided to go with this more automated approach, so that the software could call more patients on the phone and get a sense of how they were doing, if they were having any complications or side effects or anything like that. But of course their natural question was, is this working? Is this having a benefit or not? And so we, in the Geisinger Clinic side and the Geisinger Center for Health Research, like to work with the health plan and other partners whenever we can to do those kind of studies, to see whether interventions, sort of health services interventions, are having an impact. So that's how we got connected and started looking at this. So like most observational studies, there's challenges to trying to tell whether something is really having an impact or if the effect you're seeing is due to chance. But it gave us an opportunity to I think design a pretty good study with a control group, and also looking at the same patients before and after in this particular situation to look at that. So we looked at the literature, and obviously there have been studies before looking at telemonitoring, but what necessarily that telemonitoring means has been very different from study to study, and they've looked at different populations, people getting out of the hospital for any reason, which is what our study was like, versus people getting out of the hospital with a particular disease like congestive heart failure. So there was a lot of opportunity there to ask and answer this question in our environment that we thought would provide some insight that hadn't already been done before.